With an aim of increasing vaccines uptake in the country, each of the 10 launched mobile clinics aim to vaccinate 70 to 100 people per day, reaching up to 1,000 people per day, starting with the high-risk areas.
Nairobi is leading, Kiambu is following, Laikipia is also amongst the top, is in the third ranking, Garissa, Machakos, Tana River, Kajiado County, Mombasa, Busia and Nakuru. They are the top leading in terms of the burden of COVID as we speak to. We are looking at counties which have got a high population, but the vaccinations are low. So that is the low-hanging fruit. So we want to begin there, but we are also not going to leave behind the far and hard-to-reach places where the mobile clinic will go a long way to move and take the services closer to the people.
Through the ministry's Health Permanent Secretary Susan Mochache, Kenyans need to embark on vaccination as a way of ensuring the safety of all.
It is these unvaccinated people who not only risk their own lives, but also they put at risk the lives of those that are vulnerable around them. We must therefore seek out the remaining unvaccinated population even more aggressively than before through collaboration with all stakeholders.
And even as the number of infected persons continue to rise in the country, the ministry has called upon Kenyans to keep up with the mandatory wearing of masks so as to protect themselves against the deadly virus.
Mandatory is wearing of masks when in contact with other people, in closed and confined spaces such as indoor meetings. Those will continue. And I see non-conformance still with us. We are just giving people time to acclimatize. But within a very short time, you're going to have to face the law if you're not wearing a mask, because it has been declared as a mandatory measure on the grounds of public health that we must all wear masks when we're amongst other people.
Operated in partnership with the county health departments and adhering to health and infection prevention control standards, the custom-built clinics are fitted with solar-powered fridges and backup power supply even in difficult-to-reach areas to ensure their effective deployment.
Has all the amenities needed to enable safe vaccination and is able to stand on its own but be taken to very rural areas. The total cost per unit is 2.5 million Kenya shillings, but that means that beyond COVID vaccination, it can also be used to accelerate other vaccines through integration, as was said earlier. In fact, today, I think we're also giving PCV vaccine, and even as it goes out, it's also, and the discussion we've had with AstraZeneca, is that in future it can also be used for testing people for diabetes, testing people for early diagnosis of cancer, testing people for hypertension.
As of 17th June 2022, 31.4% of the adult population in Kenya was fully vaccinated against COVID-19. The availability of the mobile clinics will help speed up the process of vaccination in the country and therefore help mitigate the spread of COVID-19 in different parts of the country. Robi Omondi, K24, Nairobi.